Morning, we're talking vaccines, and I want to welcome the Chief Medical Officer, the Dr. Roshan Parashram, who's everybody's favorite CMO these days. Good morning, Dr. Parashram. How are you doing?
Good morning, and good morning to Trinidad and Tobago.
Thank you
Everything is
so much.
fine this morning.
Thank you so much for joining us this morning. We've been chatting about vaccines. We had Dr. Augustine on earlier, and he was talking about why it's important for us to take the vaccine, and he gave us a very interesting analogy about why the vaccines were created so quickly. He was saying basically that if you have all the world's best builders and you have all the money in the world and you have the biggest piece of land, you can build a house as fast as possible. And it's very similar with the vaccines because people are concerned about how quickly the vaccine came on board. But I have a question for you, Doc. With regards to mixing the vaccines, because we've gotten different vaccines from different places. And Canada is now saying that you can mix vaccines. Are we going to follow suit in Trinidad and Tobago?
All right. Generally speaking, the mixing of vaccines, I think, arose out of some shortages and different types. People going ahead with first dose, for example, and then using up your first dose of a particular type, and then having to use a second dose. So, as you said, in Canada, I think they began to do Pfizer together with Moderna, and they're actually seeing, in terms of the data, they're seeing a good effect, meaning a good immune response is being generated, and it's good news, I suppose. Bearing in mind, both of them are the same type of vaccine, being mRNA vaccine. So they are on the same platform. Therefore, theoretically, they will be the ones to mix if you're going to mix of a similar background. Right. So generally speaking, the policy in Trinidad and Tobago remains, however, at this point, that we use like for like. So we use Sinopharm first dose, Sinopharm second dose, AstraZeneca first dose, AstraZeneca second dose. At least for now, until more data, more studies are done, more data is given, and then later on we will see if that needs to change. But for now, we see that we follow the WHO's guidance in that regard, and WHO remains in the same place where we are asking to use the same vaccine for first and second dose. In terms of interchangeability, what we have been noticing, of course, for example, AstraZeneca in Trinidad, there is interchangeability between the manufacturing sites. So we will use one AZ from Serum Institute of India as the first dose, and then we can use SK Bio, for example, as the second dose. And that has been sanctioned by the World Health Organization as well. We have that in writing that can be done because it's the same product, just different manufacturing sites. So that's the interchangeability that we use at this point in time.
At this point in time. All right. Well, if the World Health Organization also approved the use of the AstraZeneca vaccine in pregnant women, how come we don't vaccinate them with it?
Right. So they approved the use of Sinopharm in pregnant women and breastfeeding. And I think we had that discussion with Professor Montai being on the air with us earlier on in the week. Generally speaking, pregnancy is something that we have to be very cautious with. We look at side effects as it relates to pregnancy. Sometimes you don't see side effects until the fetus is born or later on in the pregnancy. We don't want to take the risk with pregnancy as yet to begin the use in pregnancy for Sinopharm, for example, because the data supplied from Sinopharm from the WHO and even in their dossier is very limited for pregnancy. So a lot of pregnant women weren't part of their trials. We don't want to begin as yet. We need to give it some time. Let us see how Sinopharm goes in the pregnant patient. Look at the data. Our Director of Women's Health is supposed to come back to our national group, hopefully today or early next week, with some more data to present to the national TAG group. And just to remind everyone, that is the group that decides nationally how a vaccine is used, whether it is used in pregnancy, whether it's used over 60, whether it's used in special populations, that sort of thing. It is chaired by myself, and again, Professor Montai is one of the members, other members of UE, senior technical person. So we make a collective assessment of the data, and we will, in the future, of course, continue to make recommendations
as we go. What's the verdict on people with autoimmune diseases? Should they take the vaccines or should they hold off?
Right. So I think that was said as well on Wednesday. Professor Montai was saying that people who are immunocompromised can receive the Sinopharm and is generally well tolerated because it's an older platform. It's an inactivated vaccine. The virus is actually inactivated so that it can't cause disease, and it seems to be very safe in that particular group. Again, I would still say to consult your primary physician before you take any vaccine. So if you have a condition, you go to your specialist You have them look at the condition, look at your status, clinical status at this point in time, and then you get the green light from them. You go ahead and have the vaccine.
And doc, some people have still been asking about, how does the vaccines that we have, how does it affect the things like the variants? Are they effective against the variants that we have in the country?
So I would say there's limited data for now in terms of the Sinopharm and the way the variants are, the way the vaccine efficacy is affected by the variant. So the data is limited in that regard for Sinopharm. There's quite a lot of data with regards to AstraZeneca, and it seems that the South African variant, for example, AstraZeneca doesn't do very well against it, and the efficacy is not very great. And you would have seen the halting of the use of AstraZeneca in South Africa post the experience with their variant, and they actually had to switch vaccines and use something else. So again, it is data now coming in for AstraZeneca, South African for sure, it's decreased efficacy. There are studies that show there may be decreased efficacy for certain other variants, for other types of vaccines that we haven't used yet. But I think we need to get out the majority of the population vaccinated. For example, if you are vaccinated and efficacy is about 90%, what you expect to have with a variant is a change in the a mutation in the virus itself. So you would still expect to retain some effectiveness going forward. So maybe from 80%, you may go to 60%, something like that. And it depends on the variant, depends on the vaccine. So it is still wise to get vaccinated very early as a population to protect ourselves generally from the virus in terms of its original lineage as well as the variants of concern.
Now, we are still at the stage where we're vaccinating, the older population and people with comorbidities. When do you assume you're going to get to general vaccines?
Right.
General
so,
population?
as the Honorable Prime Minister would have alluded to on Saturday on his press conference, he would have said that it seems that we will be getting shipments of vaccines coming in the near future, and I think he will allude to that further in the coming days and weeks. So I'll leave that up to him in terms of supply, but it really is a supply issue in the sense that once we get enough, we want to make sure the vulnerable population is captured first. So far, we have given out 106,000 vaccines thereabouts, a little over 116 first dose. Of that, 72,000 is AstraZeneca. The remainder, which is 34,000, is Sinopharm, and that's first dose. So we're really trying to capture, when you look at the vulnerable population, people over 60, those with comorbidities, you're looking at possibly a little bit higher in terms of the number of people in the population. Those are the people that will need hospitalization. Those are the people that we have seen in Trinidad and other parts of the world dying from this disease. And they are the ones in our first phase that we want to protect the most. So we continue on the trajectory until we get a large surplus of vaccines, and then we can go into phase 3, which is open to the general population. As you know, we have started phase 2, which is our frontline police, for example, teachers, a couple of weeks ago, and we continue to do bits and pieces of phase 2 as we do phase 1, because they are highly vulnerable groups and have been infected quite a lot in Trinidad.
Definitely. Now, with regards to people who've gotten fully vaccinated, who've gotten the 2 shots, right? In the US, they're saying that those people can now walk around without wearing masks. Where do we have to get to be able to get there?
I don't think wearing masks at this point, as I said, is something, even with people having their 2 doses in the early stages of the pandemic, we need to get to a stage where there's herd immunity to an extent, and people have put it at different levels, 70% of your population. You have to get to an extent where the transmission of the virus is so low in the population that it's not going to go from one person to the next, even if you have no public health measures in place. And once vaccination reaches that, you get that goal. The only way you can get to that goal is if there's population immunity outside of doing the public health measures. So again, the first target is to get to herd immunity in terms of the vaccines given to the population, getting close to 70%, and then you can begin to consider. Of course, it's not something that we go from 0 to 100. There are phases we will look at. We're looking at how the disease progresses in the country. We're looking at the number of hospitalization, severe disease. So as you increase the vaccination, you'll go from 10%, 20%, 30%, 40%. You will see the effect that it's having on the disease transmission as well. So there's no magic number, I think. We have to see, and every population behaves differently with vaccination. So let us go forward, get people vaccinated as quickly as we can in the population, and move towards a state where we can all revert to some sense of normalcy.
Now, I heard, Dr. Parashram, that the U.S. is giving the Caribbean 6 million vaccines. Do you have any idea how much of those will be coming to Trinidad and Tobago?
No, again, I think that those discussions were had by the Honorable Prime Minister, and I assume he will be making some announcements in the future.
Okay. And with regards to, I saw as well that they're giving cultural workers and entertainers and party promoters and these people who want to, get back to some sort of normalcy with regards to their work and earning money. They're giving them the benefit of being able to get their vaccines earlier and to be able to fly out and stuff like that. Do you know if we're going to put any other measures in place to get more people back out and working in some way, form, or fashion?
Yes. So that's when I mentioned phase 2, for example, we started to target people that had to be out. Throughout the pandemic, we had maintained, for example, supermarkets as being open, right? Normally, people won't consider supermarkets as a frontline sort of thing, like police and healthcare workers and that kind of thing. But what they are required to do is to keep the supermarkets open, to keep us all fed. Right. And in that regard, the cashiers, for example, the tellers, they are frontline in terms of exposure. So we have begun to pick bits of phase 2. So you're looking at people who work in supermarkets, those in pharmacies, other sectors that have to remain open at all times, whether we do closure or not, to really maintain the essentials of the economy, and to make sure that people get food, they get water, you get the electricity on time. So those are the things that we are targeting as part of the first 2 as well. So really to keep everything up and running.
CMO, is there any way that, or any intention of giving people incentives to get vaccinated? I know some people are still doubting and people are still questioning. A lot of people want it, but are we going to be giving any sort of incentives to people to get vaccinated?
Well, I mean, incentives are something, there's a lot of ethical considerations when you look at incentivizing a vaccine in particular. You have to look at the social impact of it as well. So, for example, even being able to fly, a lot of countries around the world are now requiring that you have your 2 vaccines of a certain type before you go to that country or the other. Right. So there's an incentive there for the population that if we get vaccinated, of course, you can move more freely in terms of international travel. That incentive is really put on not by us, by the global community. So there's some incentives as it is. We have noted that some countries have begun to put in other types of incentives, especially in our region and other parts of the world. Is really something to keep a close eye, but there is an ethical implication to it. But we have to, again, is really to get as many people vaccinated as possible. If in the future it requires such, we may have to consider it.
All right. I want to jump back to the last question I was asking in terms of the phases that you are. I want to know which phase do athletes and auxiliary staff fall in? Is there a phase for them? Because we have the Olympics coming up and stuff like that.
Yeah, I know there were some concessions given to national and international athletes with regard to the public health regulation, in which they were allowed to train and continue to train to represent the country. So there may be some concessions if travel is required as part of their work and part of representing the country in the coming months. But again, it is a very fluid situation. It depends on the number of vaccines we do have. And once we have an additional supply, then we will open our category a little broader.
All right, fantastic. Now, Dr. Parashram, since we've shut down the second time around, the SOE and all of that stuff, have you seen any improvements from a statistical point of view with regards to how the virus has been transmitted, or the numbers of infections and the rate of infection?
Yeah. So I have to be a little cautiously optimistic at this point. We are since the 29th, we started to put some, what I would call larger restrictions in place when we started to do closures of restaurants, those kinds of things. On the 8th, we went to essential services, almost 8th of May, essential services sort of position. And then right after that, about a week later, we went into the SOE. Cumulatively, we were beginning to see a little bit of a little response as it relates to that sort of closure. We're seeing the beginnings of it represented in the sampling in the lab. For example, out of a sample size of 94, we would have been getting 44 to 50% of those being positive. We're seeing a little reduction on the lab side of that, which is a good sign. So every run, you're seeing a decreased positivity rate reflecting in the lab sample. You're also seeing a sort of decrease in terms of the number of patients requiring hospitalization in the last week or so. So that is a good sign, and those are the things that we really keep an eye on. But again, it's too early to say. I think we're beginning to see the impact. Again, it was moving very quickly in the virus in the population. There was a high level of transmission, so it will take a little while before that plateaus and then, of course, decline. So we need to give it some time. Everyone is doing their part, I think. To a great extent, the population is following the public health guidelines, and who can get vaccinated are getting vaccinated. We need to continue that as quickly as we can, get vaccinated as quickly as we can as well, and then we will see what happens to the numbers. But we have to be mindful of small outbreaks that can happen at any given time in prisons, in different areas that are high risk, which can actually carry up the numbers very fast, and you can see quickly one going to 200 and all of that. So we're keeping an eye on those fringe populations, looking at outbreaks, trying to get those, stop those from progressing very quickly in different parts of the country. And we are hoping that we will see the beginnings of a slowing very, very soon.
All right. Well, we're going to be cautiously optimistic, like you said. Dr. Parashram, how have your medical staff been dealing with this? I mean, I know that it's been a long year plus. How are things inside the medical fraternity?
So I can't say that everything is as it should be. I mean, people working 24 hours a day for a year and a half now, and really they have provided service far and beyond what is expected of them. And really the healthcare workers have shown out for the whole pandemic. Even in the lab, when you look at the lab staff, people talk about delays in the lab and all of that. And it takes a toll on them mentally, because they have been working from 6 in the morning to sometimes 12 in the night to try to get those lab results out every day. They take sometimes little small breaks, but not for very long. And they've been going, and people look at the numbers and then they count and they say, why is this one late and this one? And it really takes a toll mentally on the staff. But they're all trying their best. They're giving their 100+% for over a year and a half. They are all, of course, tired, as is expected. But we are pushing through in the hope that, with the on incoming vaccines, and the population is really accepting the vaccines very well, that we will get to a place in the coming weeks or months that we can all have some time to go back to less of a pandemic, less of an epidemic.
Yeah, less overwhelming as well. Dr. Parashram, I want to congratulate you. I mean, you've been working very hard as well for the last year and a half. And we've been seeing you coming on the press conferences very, very often and giving us all the information. So I want to thank you for keeping us as up to date as you possibly can. Thank you for sharing your knowledge with us. And thank you for guiding us through this pandemic so far. And we hope that you continue to be in good health so that you can continue to guide us through and out of it, hopefully, with all the vaccinations and stuff like that. How have you been coping?
Thank you very much. No, I'm of course, like all the other healthcare workers, trying our best to keep going one day at a time. I think what has given us some hope as well is the vaccine. So we're in a much better place next week. I think the minister is due to have his vaccine on the Monday, and then we will follow having our second dose, and your second dose, 2 weeks after your second dose is when you see the best protection. So even on a personal level, being able to have a vaccine that protects you that well gives you that peace of mind as a person, that you're not infecting yourself. If you are infected, there's a small risk of you being hospitalized. There's a small risk of death, a much decreased risk. And of course, that you won't infect your family, your children, your parents, is something that gives you comfort, and knowing that there's a vaccine around the corner that someone can take. So really, the vaccine has helped the healthcare workers as well have that level of comfort when they see patients, that they have that added protection in addition to their mask. That really goes a long way in terms of protecting them and their loved ones.
Fantastic. Well, I want to thank you very much for joining us this morning, Dr. Roshan Parashram, Chief Medical Officer, and giving us some more information on the vaccines. And, we continue to say bless you to all of your staff, all the medical team, everybody who's been working hard for the last year and a half. Keep up the great work. Thank you guys so much.
Yeah. Thank you for having us again.
No problem. Enjoy the rest of your day. And guys, we're going to take a quick break and come back with more. We still have more inside the Now Morning Show, so don't go anywhere, all right?